Hi everyone, welcome to week 7 of your Medical Insurance for Pharmacy Technicians course. This week we are going to be covering Chapter 5. Chapter 5 covers several different things. Probably the easiest way to classify all of these different types of coverage, Medicaid, TRICARE, CHAMP VA, workers' comp and discount card programs, you could probably say they're all some sort of form of public insurance. Although you have to have certain, you have to meet certain criteria to be it to be available to you. So we'll talk a little bit about all the similarities and differences between some of these, and we're going to talk a little bit about some of the definitions that are involved with these as well. So you've got a couple of pages of learning outcomes on this PowerPoint. We're going to look at the ways that Medicaid programs vary from state to state, and the prescription coverage under Medicaid. We're going to talk about who is eligible for TRICARE and CHAMP VA and how those benefit programs work for them. And then we're also going to look at workman's comp insurance and their pharmacy coverage and any discount programs that are available for prescriptions. So there's several pages of key terms, so make sure that you've reviewed those so that you understand them. And let's start by looking at Medicaid. Medicaid is an assistance program. It is not insurance, so that makes it different from other things. So what the idea here is behind Medicaid is that it's for healthcare services for people whose income falls below specific levels, so the national poverty level. And Medicaid is funded by both federal and state government, but it's administered by your state government. So it was put into place by the federal government, but what it does is it authorizes the state to determine eligibility, and they do it within the federal guidelines. So there's federal guidelines and then there's state guidelines. So basically under the federal guidelines, these are some of the different types of healthcare services that are available under Medicaid. And then the state can include other types of coverage as well. So these are some of the things that the state can cover in addition to what the federal government is covering. Screenings, things like that. There's obviously children's services, all of those types of things. So when we look at Medicaid, we basically have a group of people who either have low incomes and have children. They're over the age of 65. They're blind. They have permanent disabilities. So you don't have to have all of these, obviously, but it could be any or all of a combination of these things. And so that is who falls into that particular program. And then once you are determined to be Medicaid eligible, then there are different types of Medicaid prescription drug plans. And every state is going to be different as far as what drugs are covered, what's not covered, what do you have to do to be able to receive your medications, how do you register for the program, how are the pharmacies reimbursed, all of those types of things. So that's all going to be based on your specific state. So there's a lot of variables there. The next type of coverage that you're going to learn about in this chapter is TRICARE. And TRICARE is the Department of Defense's health insurance plan for military personnel and their families. And honestly, I believe, and the only reason I say this is because my son was a Marine and my daughter is going into the Army. I believe there's a new name for it now, but I don't know it off the top of my head. But there still is a Department of Defense health insurance plan. I don't think it's called TRICARE anymore. I think there's a new name, but just kind of as an FYI. And it's basically a fee-for-service program, covers medically necessary services. You have to go to a military treatment facility first if it's available. So there's a lot of rules and regs around how TRICARE works. And then CHAMP VA is the veterans portion of TRICARE, basically, is probably the easiest way to put it. So this is for the healthcare costs of veterans who were permanently disabled because of service-related injuries. It covers surviving spouses. If someone died from their injury or died in service, things like that. So TRICARE and CHAMP VA, the only reason they're technically falling into this bucket of public is because they are run by the Department of Defense. So because that is government related, that's why they fall into this particular bucket. So it's the TRICARE drug program is available to anybody who's in the service. It pays towards the cost of medication based on whether or not it's generic, whether it's on formulary, off formulary, and things like that. We have co-payments for the different beneficiaries. Depending on where you get the prescription filled. Unless you are the actual service member themselves, they don't have a copay. Their medication is free. So when they talk about beneficiaries, what we're talking about are the people who are able to qualify because their family member is under TRICARE, so spouse, children, things like that. And then, of course, they have many similar things to other types of insurance, mail order, all those types of things. And then the last type of thing that you're going to be covering this week is workers' compensation. This is for work-related illness or injuries. So any type of drug program under workman's compensation it's basically a third-party prescription plan. So it's the employer's insurance that's going to be taking care of that. And last but not least, and this one doesn't really fall into the same bucket as everything else, but they did include it in this week's material, is discount card programs. And discount card programs, they talk about them being available by a state, at the state level, but there's more than that. There's also discount card programs that are available from manufacturers themselves for drugs that maybe are high expense and that type of thing. So as you go through this week's material, if you have problems or questions, please make sure that you reach out to me, and have a great week.